Hoy vamos a hablar sobre medicina tradicional china. Nos encontramos en la Clínica Internacional de Dongzhimen y venimos en busca del Dr. Zhao. El Dr. Zhao tiene más de 15 años de experiencia en este tipo de medicina.
We have four methods to diagnose patients. In Chinese, 望闻问切, 望 inspection, 闻 smelling, 问 inquiry, 切 taking pulse. Yeah. So inspection, when the patient comes inside from the door, we have already observed the patient. Yeah, from the working style and from the shape, body, and when the patient sit down, we will ask, inquiry diagnosis, ask what's the problem, and we will have a serious symptoms, what we call the syndrome. From the syndrome, we will give the patient a diagnosis. That's a characteristic of traditional Chinese medicine. Syndrome differentiation based treatment based on syndrome differentiation. And tongue diagnosis and pulse diagnosis are very important for us to judge whether the patient has cold, heat, superficial disease or deep disease. This is our diagnosis method. And which area he has a pain, he has a tenderness. When I press here, I need to ask the patient whether he has a pain feeling. 这儿疼吗？这儿还可以哈。这边呢？这儿疼。He said here he feels pain, and this area is almost cervical 6. And this part corresponds to the ulnar nerve. Normally, the patient has an electric feeling along the ulnar nerve to the ring finger to the small finger, because the ulnar nerve has been pressed here. And when I press the lower part, 这儿疼吗？这儿，这儿还可以啊。最疼的是这儿，是吧？Yeah. So later I will do the acupuncture on this part. I will select some points around this part. C6 on right side, C6 on right side, and C3 and C4 on left side, and some points on the inner side of scapula.
En el próximo programa continuaremos hablando con el Dr. Zhao y veremos cómo aplica este método a su paciente.
Electric feeling. This is what we call 得气.
It doesn't hurt.
It doesn't hurt actually.